Welcome et bienvenue to the Bethune Roundtable pre-conference workshop on Indigenous peoples in global surgery. My name is Melanie Morris. I'm a Métis pediatric surgeon and pediatric urologist that works in Winnipeg, Manitoba, Canada, and I'm happy to be part of this today. In 1982, the Special Rapporteur José Martinez published a study on the widespread systemic discrimination faced by Indigenous peoples worldwide. In 2007, the United Nations published their Declaration on the Rights of Indigenous Peoples. Here in Canada, in 2015, we took on our own commission when we tackled the Commission for Truth and Reconciliation regarding the harms done to Indigenous peoples within our own country. Yet despite all these efforts, we continue to witness racism pervasively. We see systemic discrimination in all institutions. We see in the fields of surgery and in global surgery worse outcomes that are faced by our Indigenous peoples. One of the studies that's going to be described by one of our speakers today. But despite all this, we see Indigenous peoples continue to exist and continue to be present, demonstrating a profound resilience as they retain their cultures and their language and strive to autonomy. Today, we're so fortunate to have three incredible women speaking today. Our first speaker, Dr. Susan Moffat-Bruce, is the CEO of the Royal College of Physicians and Surgeons of Canada, a pioneer women thoracic surgeon in our country, and is going to talk about this issue faced by Indigenous people and the disparities from an institutional lens. After that, we have Dr. Donna May Kima-Liarjuk, who's an Inuk cardiac surgeon finishing her fellowship at the Cleveland Clinic. She has the lens to talk about what it is to be an Indigenous surgeon going into the workforce and looking at a career within the global surgery context. She recently published on the disparities faced by the Inuit people in surgery, and we'll speak to that today. Lastly, we have Dr. Stephanie Sinclair, who is going to talk to us about successful projects. She's an Anishinaabe PhD candidate in Winnipeg who recently pioneered returning birthing back to Indigenous communities and is funded by the CIHR to improve care of maternal health with the implementation of doulas in Indigenous communities. I look forward to coming back together as a group after these outstanding presentations, after we've heard from the knowledge of these women, to discuss the future, how we tackle racism, how we tackle discrimination, how we look at a world we can create where we embrace cultural safety, where we look at where Indigenous peoples can survive in a global surgery context as a team. Thank you.